Good morning, afternoon. Thank you for joining us today for this webcast, Navigating Portfolio Company Challenges During Reopening. I'm Bethany Evans, Chief Performance Officer with EHS Support. I'm also Director of the ACG Pittsburgh Future Corporate Leaders Board. To kick things off, I would first like to thank ACG Pittsburgh annual sponsors. We would not be here without their generosity, especially at this time when things are still uncertain. We are very grateful. If you're interested in becoming a sponsor, please let me know. As a sponsor, anyone from your firm can attend an ACG Pittsburgh event for the member rate. And we have some really exciting in-person and virtual events on the horizon. Sponsorship also includes a free membership for an individual under the age of 40. So that's pretty exciting as well. And now moving right on to today's event. Monica Meyer, Health and Safety Practice Leader at EHS Support, will lead our program. Monica has partnered with clients around the globe, helping them perform strategic assessments and develop and implement health and safety programs that mitigate company risks. She has a pretty long proven track record of delivering results and bottom line oriented solutions that drive cultural change, reduce costs, and reduce risk rankings of likelihood and impact on factors related to company health and safety. So Monica, I'll hand it over to you now.
Monica.
You're still muted, Monica?
Okay, here we go. Let me share my screen here and we'll jump into this. Trying to.
See you moving.
It should have popped up.
Did you make sure to select the window and then click the share button?
You can troubleshoot some of the audio issues here.
All right, just let me know. It's I should have screen one.
And there should be so maybe stop the share. There you go. Oh,
right.
Hold on.
You can see the opening slide?
No, we're seeing the other screen. If you just click display settings, swap display. There you go. Now we can.
Oh, interesting. Okay, that just went to my different monitor, so give me a second here.
Sorry to throw you off. That's
all right. All right, let me just move this a bit here so I make sure I can see everything. All right, well, good morning, and thanks, Bethany, for that. And, you know, I just want to say it is a pleasure to partner with ACG Pittsburgh, and I want to welcome you, each of you, to this webinar covering Navigating Portfolio Company Health and Safety, the Challenges During Reopening. My intent today is to provide you with practical health and safety and business recommendations that can be used at all levels of your organization as you bring personnel back to work, or as you continue your operations, as well as provide you, information on the importance of developing or enhancing your infectious disease preparedness and emergency response plan. So we know it's been crazy over the past 6 months, and we recognize that COVID's been redefining what everybody is calling business as usual, and what that looks like now as well as in the upcoming months. When normalcy is disrupted, how do you react? And I believe the most successful are the ones who study the new reality and innovate to meet its challenges. Those that come through this crisis are the ones who learn to adapt rapidly, think creatively, exercise agility, and take advantage of the opportunities as they present themselves. Disruptions are really nothing new. We've had storms, diseases, recessions, wars, and climate challenges every few years for as long as we've been keeping records. But it's how we understand those challenges and share lessons learned and key information with one another in an effort to define best practices quickly during a turbulent time. And COVID has had a huge influence on culture. If we as leaders talk about getting things back to normal, we need to recognize that some of these influences will have permanently changed the safety culture, and we need to reassess and not blindly expect they will simply pick up where they left off. listen, we recognize none of us are really working on the vaccine for COVID, but we are dealing with a pandemic, and that none of us have ever dealt with these types of issues before. What we at EHS Support are doing is working with clients and colleagues to research, process the information we have been given by experts, and the opportunities those solutions can create. And then we're sharing them. We realize that many of you just want questions answered. You want it in black and white and yes and no terms. Sometimes you can get those answers, and other times by movement forward, it's based on good decisions and efforts by leveraging all the sources of information provided. So while a bit different from each of you listening, we recognize the current scenarios that either you are able to stay open and be deemed essential and have personnel working along the whole time, or you've had to suspend business and are beginning to daylight, and you're trying to manage operations and the safety of personnel in the best manner possible while working lean. So there's likely a level of discomfort with uncertainties pretty much mounting daily on whether you've been operating or about to operate properly, and then minimizing the spread of the virus and how to bring non-essential personnel back to work. You might have a slight headache. So as we keep moving forward, how do we get used to working not in a new normal, but exceptional times? Every company's efforts are going to be different. There's no one size fits all. And as no one knows precisely how this will play out across the remainder of 2020. So it hasn't been a short-term fix, folks. I mean, the magic ball isn't giving us the answers. So we have to listen to experts and plan accordingly. It is critical that organizations and, we plan as appropriately. So everyone on this webinar has reacted differently over the course of the past few months. Some assumed it would stay an international issue. Some were and still may be glued to the TV and were or are still nervous that they were underreacting or overreacting. And some have yet to react in any way because maybe you're in an area that where it hasn't quite hit home or affected anyone you know. And some are just plain fed up now with the back and forth between experts and what the data is actually presenting. What I have realized is that we are all on a different point on the spectrum when it comes to opinion on how to react to current situation. So it's affected by those it's affected by those who we deem as experts, the CDC, which is the Centers for Disease Control, WHO, medical professionals, the news and media. Everybody has a different play in this. And even leaders in our organization and those who we interact with frequently. So what I would like us all to agree on is that the culprit has not gone away and that we are still in a fluid environment. And no matter what, we have to plan on behalf of our company to follow legal requirements, manage compliance, and protect our personnel. Some of us are tasked with determining how it affects production. Some of us are tasked with how it impacts financial stability, our portfolio companies, the safety of our personnel, or legal ramifications. Therefore, we have to put some opinions to the side and do right by our own company, and noting that staying in compliance is a financial advantage, and determining and understanding risk is key. So let's take a look at the elements involved to manage these types of events as integrated into a business continuity plan. So I'm giving you right here we're looking at an emergency management cycle just to give the framework. And one here is mitigation activities that allow organizations, no matter the size, it could be small, medium, or large, to take sustained actions to reduce or eliminate long-term risks to people, employees and public, and their physical assets from hazards and their effects. So done in conjunction with a hazard analysis, which helps to identify, what events can occur, the likelihood that an event will occur, and the consequences or severity of the event. So this is where a lot of effort takes place. Here is where I'm so sorry, not sure why that's bouncing around, but basically here is where, we're going to put a lot of effort. And, we got to roll up our sleeves as a team and decide what you should be doing. It ties directly into preparedness and prevention, which is number 2 there. And then dang, we get hit with this event, a pandemic. And now we're to respond and then try to recover so that we can resume operations with a sense of new normalcy. So our discussion today is going to hit each of these topics. The coronavirus recession has left no industry unaffected, but we encourage you to prepare for all scenarios. The crisis isn't just threatening to decimate particular industries, it's also reshaping their futures. So most of you may have a business continuity plan, but they may not fully address the fast-moving and unknown variables that we have been seeing and that we're continuing to see. So daily we see the ebbs and flow and unfolding that COVID is creating, and it's really wreaking havoc on some, bottom lines in every business. So we must be agile from the top to the bottom. So what we have done is we've prepared an infectious disease preparedness and emergency response plan template, along with other resources and tools that will help guide you through this cycle, which you'll be getting afterwards. So, and it can also be used as part of your current emergency response plan as well. So what I put up here is, this is just a snapshot of some of the key requirements that I'm going to be touching on. Where are we at in our response planning and back to work plan? Have we assigned roles and responsibilities? Have we trained our personnel accordingly? Have we instituted protocols, procedures, and controls that people understand and can execute to properly manage these risks? So why? Is none of us want to see an outbreak at our facilities, for the human aspect first, as well as the business aspect. Granted, the meat processing industry has generated the most attention, but we can pull some lessons learned. We need to focus on the safety of our personnel, but as a business, we need to look at business risk, such as, have we thought through the potential of something bad happening and how it could play out? Do we have the parameters in place to protect the health of our business from legal ramifications? An outbreak is a material safety and health incident, but it could also lead to business interruption or potentially another temporary facility closure. So, you know what, let's just sit on this for a minute and play out this scenario that, what if we get the unwanted phone call that someone at your facility has been exposed or test positive for COVID-19? Initial thought may be, do we have to shut down the facility? Do we have to tell the person's coworkers? Do we have to contact the government? There are no simple yes or no answers, but we have to first look at the law, then ensure we're following corporate policy, if one exists. And then listen, if you don't have a policy or a response plan to work from, our plan template that we're providing will help develop those key components for a plan. So if the employee tests positive, we want to act immediately. Well, how do we do this? We ensure that we have the necessary parameters in place. And that's why we're here today. Offer support. Take a moment to be there for them, not by offering health advice, but lead with some emotional intelligence. Report via your reporting process, which likely includes human resources. And note, if you don't have a reporting process in place, the tools that we're giving you, will help you develop this as part of your plan. The next, is explain your company's policy. If the employee is at work and does not require urgent care, and ask them to quarantine, you want to make sure that happens. Meaning self-isolation and not coming to work or working remotely, if possible, for at least 10 days. Certain states or localities with high rates of transmission may take a more cautious approach and require a longer quarantine period of 14 days. So then you or human resources will inform them of available options such as paid time off or sick leave if they cannot work remotely. You or human resources will explain, the privacy rules under Americans with Disabilities Act, or ADA, not revealing the fact that they tested positive to their colleagues. They can be told the employee is on leave of absence for non-disciplinary reasons, though. And then we want to assess the risk. Ask the employee about their activity in the past 14 days prior to testing positive. Identify the areas of the workplace or workplaces the employees spent most of their time, with what colleagues they had close contact. And by close contact, the CDC, or the Centers for Disease Control, defines this as being within 6 feet for 15 minutes or longer. Also, establish what clients, vendors, or third parties the employee was in close contact with in the 14 days prior to testing positive. These individuals should be contacted without, disclosing their identity. And this shouldn't be the end of your communication, with the sick employees, because if possible, you and other senior leaders should call regularly to check in and offer support. And then we need to take action. So that means close off and deep clean or disinfect areas of the workplace in which the employees spent time prior to the diagnosis, especially all those common areas. We have provided cleaning and disinfecting guidance as Appendix B to the plan that you'll be getting. So you can refer to that for all of the cleaning information and how long you're supposed to do things and what agents you're to use. Time and fresh air are also a powerful disinfecting agent. If an area is left vacant for 7 days or more, only routine cleaning is needed. Because the CDC says the virus that causes COVID has not been shown to survive on surfaces longer than that time. So likewise, outdoor areas do not need to be disinfected. Then we want to inform employees who are in close contact. Sorry, I'm not sure why that's doing that, but I'm sorry. We want to inform employees that have had close contact with that person, especially within 6 feet of the infected person for 15 minutes or more, with the employee, that you have reason to believe that they were in contact with someone who has since tested positive for COVID, without, improperly or inadvertently divulging private information of the affected employee. So we don't want to mention their name or any easily identifiable information such as their job title. And then we're going to instruct the at-risk or those that were exposed employees to self-isolate for 14 days. Tell them to watch out for symptoms and suggest that they contact their healthcare provider. If the period of self-isolation means that they will not be able to work, they should be placed on paid sick leave, either under company policy or using the emergency sick leave package offered by the Families First Coronavirus Response Act. Then informing all employees, let HR notify the rest of your organization, or at least those based in the same workplace, that they can communicate they'll communicate what actions need to be taken, and reassuring them all that the company is doing everything possible to ensure their safety. And then encourage everybody to inform human resources of any questions or concerns that they may have. So when that employee returns to work, you can determine that, but you don't have to by testing alone. The CDC advises employers not to require a negative COVID test before employees return to work, but instead to follow these guidelines. So I basically listed everything out here on the slide, and you will be getting a copy of the slide deck, so you don't have to take all of these notes that are in these bullets. But those who never develop symptoms can end isolation 10 days after testing positive. Those with moderate to mild symptoms can end isolation after 10 days if at least 24 hours have passed without that fever and or those other symptoms, as long as they've improved. And those with severe symptoms, they may need to continue isolation for a full 20 days or longer. And then, employees may return to work earlier if a doctor confirms the cause of the employee's fever or other symptoms is not COVID related and provides a written release for the employee to return to work. Remember, facts on the ground are rapidly changing. So before making any decisions, get expert advice. And you should also consult your local health department, to inform them and ask them for any best practices in your region. So constant communication and updates of information and protocols are going to be key. And how do I deep clean or disinfect? I've summarized everything here, but I mentioned about taking action and deep cleaning and disinfecting of rooms or areas occupied by those with suspected or confirmed COVID-19, as well as all the machines and equipment, tools and surfaces that they've either, been around or, personally they work on. So you may be wondering, what's the proper way to do that? Well, cleaning refers to using soap and water to reduce the number of germs, and dirt and impurities on the surface. So we want to practice routine cleaning of frequently touched surfaces. But disinfecting works by using the chemicals, for example, EPA-registered disinfectants, to kill germs on surfaces. More frequent cleaning and disinfecting is required based on the level of use, especially in public places. In regards to timing, though, close off areas visited by the ill persons, open outside doors and windows, and use ventilating fans if you can to increase the air circulation in the area. Wait 24 hours or as long as practical before beginning cleaning and disinfection. Cleaning staff should clean and disinfect all areas such as offices, bathrooms, common areas, shared electronic equipment used by the ill persons, focusing especially on frequently touched surfaces. And if it's been more than 7 days since the person with suspected or confirmed COVID visited or used a facility, additional cleaning and disinfection is not necessary. So we're going to switch it up a little bit now and talk about the compliance. So under OSHA, employers must comply with safety and health standards and regulations issued and enforced by OSHA or an OSHA-approved state plan, which I provided there on the slide to the right. So, for PA, we're not an OSHA-approved state plan. We follow federal guidelines. So where no safety and health standards and or regulations have been issued, such as the case with COVID, OSHA relies on the general duty clause that requires employers to provide their employees with a workplace free from recognized hazards, likely to cause death or serious or physical harm. So OSHA has provided the guidance on preventing workplaces for COVID-19, it's a document, and the OSHA Interim Enforcement Response Plan for Coronavirus Disease 2019 as a guidance, and they are accessible on their webpage and in the workplace COVID-19 resources that we will be providing as a handout. So I have a handout that, for many industries, where you can go to, it's provided with links on where you can go and access all sorts of information. But these are the two OSHA updates that they have provided. Recently, though, this has been updated a couple of times, and the latest one is being May 19th of this year. And they have also prepared record-keeping requirements as this pertains to workers' compensation and the OSHA logs that we're required to keep. So that's what I want to touch base on now, is the OSHA record-keeping requirements. COVID-19 is considered to be an illness. So an illness is work-related. It is work-related if an event or exposure in a work environment either caused or contributed to the resulting condition, or it significantly aggravated a pre-existing injury or illness. So thus, we as employers are responsible for recording cases if those things mentioned there in the green. The case is a confirmed case of COVID as defined by the CDC. It is work-related as defined by the standards, which is 1904.5. And the case involves one or more of the general recording criteria set by point 7. So medical treatment beyond first aid, days away from work, and so forth. So these logs are to be updated, and if you would have these cases that are deemed work-related. For cases, the term incident means an exposure to SARS-CoV, -2 in the workplace. So therefore, in order to be reportable, an inpatient hospitalization due to COVID must occur within 24 hours of an exposure to the virus at work. So the employer must report such hospitalization within 24 hours of knowing both the employee has been inpatient hospitalized and that the reason for the hospitalization was a work-related case of COVID. So if an employer learns that an employee was inpatient hospitalized within 24 hours of a work-related incident and determines afterward that the cause of the hospitalization was a work-related case of COVID, the case must be reported within 24 hours of that determination. Then I've listed some other applicable OSHA standards and that you may want to dive into. And like I said, you'll get a copy of these slides. So these are for general industry, which is, CFR 1910. But if somebody on this call now is with the construction industry, you can go to 29 CFR 1926 standards, where these topics, same topics, are covered. And we touched on some of the record keeping and reporting. So assessing for the necessary personal protective equipment for eyes and face, hands and respiratory protection, sanitation that covers housekeeping, waste disposal, drinking, water dispensers, anything like that. What about the 145? So that's specifications for accident prevention signs and tags. So do we have reminders up to maintain greater than 6 foot distance between others? Or are we blocking an area off to the public or visitors or to other people in our company to minimize exposure and contamination? That covers the signage. Hazard communication, which would relate to safety data sheets. And then bloodborne pathogens, where we want to protect and prevent exposure to blood and other potentially infectious material that offers a framework that may help control some sources of the virus. So to stay on compliance for a second, let's discuss OSHA inspections. Okay, those businesses having a very high exposure risk, such as hospitals, emergency medical centers, emergency response facilities, they're going to be the primary focus of inspection activities in response to COVID-related complaints or referrals and employee reported illnesses. But if one of us should happen to have workers contract the virus and complaints are filed, will duty officers show up? Yes, in fact, it's already happened. And they can also be remote, or they can show up on site. So the compliance officer will determine whether the employer has a written pandemic plan or an emergency response preparedness plan. And then they will review the facility's procedure for hazard assessment and protocols for personal protective equipment use. How do we handle the potential of exposure? Those who tested positive, our cleaning and disinfecting procedures, employee training records related to COVID exposure or in preparation for a pandemic, and then the hierarchy of controls for worker protection, which is coming up next. So to satisfy the requirement of the general duty clause, so a couple slides ago, that catch-22, where there's really no regulation that covers this, employers must undertake a hazard identification analysis to identify the steps that should be taken in order to reduce the risk of worker exposure. So every hazard analysis contains 3 basic elements. 1, identification of workers at high risk, and really just determining the risks. 2, identification of potential sources of exposure. And 3, identification of appropriate control measures. So how are we going to implement this and protect everyone? Once the hazard identification analysis is complete, you can use that information to input into your emergency response plan that we're giving you. As an employer, your best defense against OSHA liability is to have a robust plan, strictly to adhere to its procedures and protocols, which as you can see, should be very fluid because things are changing daily and weekly, and it should be easily updated. So these plans are also, an employer's best defense against OSHA's anti-retaliation claims filed by employees who have either complained to OSHA about workplace conditions or refused to return to work because based on reasonable fears of exposure to COVID, they're not wanting to come back in. So let's take a look at the first element of a hazard analysis, and that's determining the risk exposure. So the top 2 are those very high risk and high risk, and they're most exclusively for the healthcare industry. The medium and lower exposure risk categories are where we want to focus because I'm assuming most everyone on this call will fall under the medium or lower exposure risks. So medium exposure entail jobs that may come into contact with the public or where you are working in proximity to others. This would be areas or departments where personnel are dealing with delivery drivers, shipping and receiving, maintenance and contractors, or the public interaction, so your customers. This is a contact sport because you have to be in contact with it to have the exposure and the risk. The mitigation we're going to talk about is how are we going to limit that contact? And this is where OSHA recommends adding engineering and administrative controls, which we'll look at shortly. And then the lower risk category, that has minimal occupational contact with the public and other coworkers. And this is where the general guidance comes in that is similar to the Centers for Disease Control's, the CDC. So as OSHA stated, to conduct a hazard assessment, we suggest digging in a bit deeper and conducting a failure modes and effects analysis, or an FMEA, which will allow you to assess your facility's functional units and process areas, which may include, raw product receiving and movement, so maybe your warehouse, chemical product receiving, production areas, packaging lines, packaging in itself, laboratories, if you have multi-team operations, waste management, any areas that you have dispatch or maintenance, and general office duties. So in this approach, we're looking at where in the facility you have human interaction, coworkers in contact with one another or the outsiders. For example, product receiving and finished product dispatch have contact with vendors and trucking subcontractors. Your office personnel who welcome people coming in the door along processing lines or during maintenance and repair activities, or etc. And they have higher number of contacts with people that are remote from the facility. So we want to collectively assess interaction with external parties, so contractors, sales, drivers, delivery, interactions with other staff members in the business, so your maintenance or operators, your field workers, okay, those going away from the facility, so sales, delivery, field staff, and then those handover or transfers to the next person. So whether it's product, paperwork, tools, whatever it may be. And now we want to look at the hierarchy of controls. And these are, for all the hazards and the risks that we have uncovered in our companies. And by now I'm going to assume that everyone on the call has heard of the hierarchy of controls. But let me give you a few ways of wrapping your arms around this and showcasing what works and what doesn't. We have to look at this from different views. So number one, in the case of applying hierarchy of controls for COVID and not spreading the virus, let's look at it from the bottom up. We always look at it from the top down, but let's switch it up a little bit. It's very tempting for all of us to use PPE as the first line of defense because it's typically readily available, inexpensive, and easily implemented. But in reality, personal protective equipment, or PPE, is the least effective strategy because it relies on adequate supplies and proper and continuous use. Next level up is the administrative controls. So it's changing the way work is performed. As we have seen, many have instituted work from home. A lot of people love it, some people not so much, but we need to help personnel change the way they work and implement procedures and protocols for how to keep a distance of 6 feet or greater in between us. We got to give personnel the proper cleaners and disinfectants and provide proper training and communicate thoroughly to all personnel. And then next up is the engineering controls. And this is where we separate the workers from the hazards. Now remember, we're looking at it from the application of hierarchy of controls towards COVID. So that this doesn't mean worst case scenario of, oh geez, I got to move my entire process line, but how can we install a physical barrier? It could be a curtain, it could be plexiglass between worker to worker or worker to consumer or customer. And then again, maybe as you evaluate, you realize you will need to make changes to your process. But that's to be evaluated and done where you've decided there is a true need, not as a first gut reaction, item in your risk assessment. And then now let's get to the most effective control, is elimination, where we have to physically remove the hazard, which is me, you, employees, and that's social isolation. So we have to dig deep. We're not going to substitute temporary workers for our workforce or eliminate the hazard just by shutting the doors for the next year. We know that can't happen. Because when it comes to substitution and elimination, where do we go? And that's why we are classifying the risk, determining what is acceptable. And, I'm going to assume that this year's budget didn't necessarily include a redesign of your entire process to keep employees or customers at a distance. So there we go again. So that's why we're doing all this. This is where our assessment of severity and probability comes into play. We're not going to throw $1 million at something if we can implement these other controls. So substitution and elimination could entail that, but are not likely options in the short term, a fix, but should be evaluated if you have very high risk. So let's look at engineering controls. How do we implement when we are on the manufacturing line, working side by side during a repair or delivering supplies? What are the controls? Well, this is what needs evaluated. We can understand and visualize some examples of barriers between people and equipment or people to people. Ensuring they are transparent, flexible, and portable. But what about getting with facilities and maintenance personnel and evaluating the installation of appropriate high efficiency air filters in certain rooms? Has your HVAC systems been shut down or on setback? Or mechanical and life safety systems been, checked to ensure it's ready for occupancy? You may need to increase the rate of ventilation and make an effort to bring more fresh air outside, into the workspace. But such an action, could result in more frequent changes in air filters. So, we got to do the work with our maintenance and the HVAC contractors. There's the new and exciting buzzing wristbands that provide, active feedback. They vibrate and have some visual and audible alarms to guard and warn workers when somebody is getting closer than 6 feet or whatever distance you program them to be. And they also have passive actions as they track worker interactions. So if you were in contact with somebody and they test positive, and people need to be quarantined, you can go back through and see who you were in contact with. We can provide items such as no-touch sanitizing stations, as well as trash cans. We can give all employees stylus pens so they don't have to touch shared control panels or computer screens, vending machines, buttons, time clocks at the gas pumps. We're also looking at single-use utensils instead of washing silverware in your cafeterias or in your break rooms. And even out, expanding your break areas, so your outdoor seating, just expanding those seating areas. In some instances, as mentioned earlier, the need for process line modifications and engineering upgrades, like robotic arms, are pushing their way into the mix as well. So it's a vast array of engineering controls that's going to protect that worker from the actual issue itself. So let's all think, it's interesting to see what all organizations are coming up with, but none of these are necessarily appropriate in all situations. So for administrative controls or safe work practice controls, I'm not going to go through each of these in detail as you'll have this presentation, but what we have seen with clients in many work areas, that controls can be achieved, but they have to be thought out and personnel must be trained, okay? You can stagger the start and end times of personnel and limit the number of people at any one time in meetings, work areas, elevators, bathrooms, etc. But please post instructional signs to communicate properly. Don't just assume people understand what you told them earlier today is going to play out over the next month. Evaluate your manufacturing flow or staffing and make adjustments. Utilize virtual meetings. Devise signage via stickers or freestanding posts to ensure social distancing. Define who your essential contractors are. An electrician that needs to work on your electrical system versus a painter that just needs to brush up the paint on the walls, reveals priority need. So beforehand, evaluate your contractor's pandemic preparedness and response plan, because you're letting them come into your work area, their protocols for working around your folks, and have them submit their job safety analysis, especially if they cannot work greater than 6 feet away from your personnel, such as, if your maintenance personnel are working on something and you need outside contractors to help them. Ask for that information ahead of time, because you're now having outside personnel interact with your folks, and you want to make sure that those contractors have their ducks in a row as well. Devise transfer and disinfecting stations where the used tool or accessory or product is placed on a surface, disinfected, and marked with maybe a go or no-go label so that the next person knows that it's ready to take. Some other ones here that I put up, designate a champion to continually monitor federal, state, and local government guidelines for updated information. Believe me, I'm tackling this all the time, and weekly, one state allows other states to come in without quarantining, and the next week they change it. So somebody's got to keep ahead of that. Increasing cleaning and disinfecting of areas where there's constant touch points. I mean, we know that's a no-brainer, but did you update your hazard communication program and its training to include these new training protocols? What required PPE is needed now to be worn? And the new safety data sheets that it's accompanying those products that you're cleaning with. So what was required previously for products used like Harry Homeowner may now be vastly changed, along with the storage of larger quantities. Okay, so we got to keep up with this stuff. And then review the need for personnel to be brutally honest about their symptoms when they self-monitor prior to coming into work. We know that the symptoms they have changed, and they get updated every once in a while. So we have to have people be brutally honest with themselves about coming into work. How about, assigning one operator per shift, if possible, for company vehicles, loaders and forklifts, and equipment operating stations, okay? At the start of the next shift, the oncoming operator disinfects all touch points and so forth, and it's ready to go. Then many companies or facilities are conducting pre-entry monitoring for everyone prior to entering the gate or facility entrance. This may include a go, no-go process of asking 3 to 5 questions, such as, have you been exposed to a person who tested positive for COVID-19? Conducting temperature checks. But let's be careful not to always follow the leader because you found out another company was doing this. For instance, the use of medical grade infrared thermometers have accuracy ratings, plus or minus 3.5 degrees, depending on the brand. And states differ in their criteria for temperature of, fever, such as Delaware's 99.5, and here in PA, it's 100.4. And yet the cutoff for Texas is 100. So if we're in Delaware and we're going to put someone in charge of telling a person to step aside and go into isolation because they have a temperature of 99.9 degrees and they can't work today, we have to understand what all steps they need to take. I mean, heck, if Pop-Tarts include instructions that have to say remove pastry from foil pouch before heating, you can imagine how many people might not use a non-contact infrared thermometer gun or other thermal reading devices correctly. So, okay. And we don't want to forget about field work or travel or risk assessments. So at EHS Support, we have developed field work and travel risk assessment for anyone who basically leaves the office to perform any type of work. And we're sharing that with you. So we have helped numerous others in different industries implement the same measures. And I've included this in the resource and tools packet that you will receive, but as always, it's very fluid, okay? The risk assessment process was very rigid at first and is now going through a de-escalation process as we see states and companies begin daylighting. But we still look at all potential risk. We look at it from a legal perspective first. So Are we deemed essential? Are your personnel deemed essential? Okay. And are we required to quarantine if we cross state lines? So you have to do some digging. Okay. We look at it from a project specific risk. Activities to be conducted in a high risk area. We're looking at, are we going into some major city that still has lots of requirements and restrictions? Or are we going some other place that really doesn't have, a high risk? We've developed calculations for that just to determine what level of risk that we are willing to accept. Are people going to an occupied or a vacant site? Will they be working with subcontractors out there? So we evaluate their protocols. So if we're bringing a contractor on board to go out to a project with us, we're asking them to submit your plan, submit your JSAs, your job safety analysis, so we can review them so that you're not negatively impacting our folks. And can our personnel conduct business or perform work while keeping a safe distance from others? And if not, we have to tell them what specifically they need to do. So for instance, what state or country are they going into? Which right now, no other countries, but the states. And what are the active and confirmed cases and deaths? Will they need to rent a vehicle? So are you providing your personnel on how to properly clean a rental vehicle, or can they get one remotely without going inside? Are they staying in a hotel? And do you have parameters on what you should be doing at a hotel? Are they going to a client or customer site? And do we check and see if they've had any positive cases? Because what if they didn't clean? What if they didn't isolate their folks? What if they haven't followed appropriate quarantine guidelines? We have to do our due diligence in ensuring we're sending our personnel to a safe environment. So we're doing that due diligence, and we're trying to identify and mitigate risk. And then we're training our personnel on our processes to prevent exposure and possible workers' comp cases and possible litigation. And then just some quick other slides here are, if you have been sort of at rest or on shutdown and you're starting to daylight and so forth, we want to conduct pre-work hazard assessments or inspections. If loaders, forklifts, cranes, emergency showers and forklifts, or fire extinguishers have been left idle, ensure they're inspected and working properly prior to people coming back, okay? And don't forget about these creatures here, our wildlife, because they like to expand their lodging during, stops or lulls in operational activities. Walk the inside and outside parameters of facilities so that when people are coming back, we're ready to roll. And now I want to shift focus to a hot topic, face coverings. So determine what will be necessary for the protection of your personnel if needing to work within proximity of others. Therefore, you need to evaluate and communicate when one is needed as source control. It is also dependent on the state or local government order. So right now, the experts, they tell us it is the best option, along with proper hygiene and social distancing, since it is possible that we could still have the virus without showing any symptoms, and it could spread before we realize we're sick. Also communicate that masks should be washed after each use, or for disposable masks, they should be discarded whenever visibly soiled or damaged. And we may see a second round of mandates. So, did you prepare and do you have some on hand? Are you able to get a shipment in and supply them so they can have in certain areas during the workday or at home if required by state and local governments? And then also I want to clarify that wearing the mask does not count as wearing personal protective equipment. Therefore does not have to be fit tested or need a respiratory protection program. But I also want to encourage you that if you haven't already, to plan for getting the required respirators for your activities, as supplies they've increased and then they've gotten low again. And then conduct refresher training for those who are to wear respirators, such as the N95 style or the tight fitting ones or whatever, so they don't get lax on the company's PPE, personal protective equipment requirements. Okay. Now, this is another switch here is Again, not knowing the entire audience listening to this presentation, I realize that many of you could work for a company with more than 500 employees, which would make you exempt from this. But I recognize that there are some of you listening where this may apply. So under the human resources realm, human resources in your companies are going to be addressing the Families First Coronavirus Response Act and recognizing that COVID and this Response Act can impact your staffing. So some of you are already seeing a lot of your staff taking advantage of this, while others that are on the call haven't even had an issue yet. So expect that over time, you're going to have to become well-versed in this and know really what it's covering. And this is just a screenshot of the actual document from the U.S. Department of Labor, and it defines the qualifying reasons for leave related to COVID. This document will be provided in our resources to you. And on a side note, the only recent change of significance since this came out at the onset of the pandemic is the one federal judge has recommended that employers lessen the burden of showing proof of the need for the FFCRA leave time on employees. So stating that employees should simply be granted if they express the need. So other than that, the program is still the same. You know, waiting with anticipation on, you know, if they extend into 2021, but likely they will have a lot to do with the upcoming election results on how this does play out. So EHS support has expertise in everything that we're mentioning here, both from our own company application and for application within the industry. If you want to call us to get human resource advice, we'd be happy to help, but that's not why we're here. But we recognize that you may want to discuss this for the very short term. Then we have a few observations on some lessons learned, which could be positive and or negative. So we understand that, you know, there's been the need for speed, and the pandemic has obeyed really no speed limits. So we've all had to adapt through quick fixes and workarounds. Some emerging successful companies have and still are reimagining their business model. The concept of work from home was a far-fetched dream for some, and then it had to happen overnight. And many are going to continue this work model and with great success. So that's cool. Departmental employees were redeployed to inside sales and conducting remote training so that, you know, their roles kind of switched so that they could still continue to work. They just reinvigorated these positions so that, you know, they need it done. So why not take our people and move them over here and knock it out? We've had several companies who were able to go from 2 shifts to 3 shifts so that they could accommodate the workforce who had children to teach. So that it's pretty unique. One small company, they invested in their 5-year plan of automating 6 segments of their process line while keeping the human interaction and programming so no jobs were lost. And this was completed in 3 months, and productivity and output increased 72%. So it's an awesome win and result for this company. Some companies did not have any type of business continuity plan or emergency response plan. You know, I've called it an infectious disease preparedness and emergency response plan because it, you know, expanded into, oh, what do we do in the event of a pandemic? But some companies didn't even have an emergency response plan to begin with. And, you know, that's where we were contacted to jump in and help. They just didn't understand business interruption, and there were no policies or protocols to follow. So that was a big lesson learned for companies. Many were technology challenged. They never moved forward to investigate and adopt. So, and adapt. Now that they had to do it almost overnight, they can see how much stronger they are and how much better of an organization they have become. Regarding safety and compliance, many have strayed away from the everyday health and safety. And we're seeing this as a big issue right now. There's been such a focus on preventing the spread of COVID that the usual compliance and incident prevention was not being addressed, and it still needed to be. You know, we heard from one company that they needed to recharge and refocus on personal protective equipment. So their employees were asked to wear face coverings, and they were demanding tight-fitting full-face respirators. But yet those who required to wear N95 respirators or the tight-fitting or full face as part of their regular job duties became laxed and are confused and only wanted to wear the surgical masks or just the cloth face coverings. So it really showed an issue with their original training for people that, hey, you're working with products where you have to wear a respirator, that they didn't quite grasp that they still needed to, even though others were now wearing just face masks to prevent against COVID. So complete retraining and policy review was necessary. And there are a lot of examples that we can expand upon, but that may be a good topic in a few months as we see how things play out, as we see what's going to happen in November after the election and so forth, that we'll be hearing some different lessons learned and be happy to share. So for our listeners today, we've prepared, like I said, all these tools and resources that will be provided to you after the webinar. The tool that we see as being the most important and appropriate for any size company is the infectious disease preparedness and emergency response plan that I had mentioned a couple times. It's a template designed as a good faith effort to provide a level of protection for employees' health and safety, your critical business processes, business impact, and provides a regulatory backstop that you have been thoughtful, forward-thinking, and not reactive. So I'm confident that the template will help those of you who have not yet developed a plan to gather those key components and tactics necessary for developing and implementing a company or site-specific response plan, as well as it's going to help polish the plans of those of you who have one in place. We've developed this for our own company, for EHS Support, to define and mitigate risks as we are operating right now, and as we have been daylighting, we've always been operating, but as we now are able to go back into companies' facilities and we're able to travel more, we put these things in place to do our due diligence, minimize risk, and protect our employees, as well as we're saying, hey, we have all this in place because we're coming to your facility, and you want that, reassured to be reassured as well. Right now, the plan is maybe not going to address every question or scenario that you may have, but it does cover a lot. But it will help you think through the measures you need to implement today and in the near future as things change. And it is easily updatable. So as part of the plan, we included info, based totally on expert advice. But, with cleaning and disinfecting in your facility, how to properly isolate and return workers who are ill or tested positive. We have a travel safety protocol for you. We have information on face masks. We have information on ergonomics for those that may still be working from home and we're working remotely, and a risk assessment for sending people into the field. Other tools are being provided, are workplace posters that you can use and even edit as you see fit, or that, represents your business risk, and other things that you can use for posting to communicate properly, or that you can use for training. So everything that we've devised, we want to share with you as just value adds so that, we can help businesses of all sizes. So, I sincerely hope that, this high-level overview has provided insight on measures to mitigate, to plan, to respond and recover as you navigate this dynamic environment. Like I said, it's very fluid. Things are changing. Somebody's got to be on top of that. And we're definitely able to assist and support you with advice if you ever have the need. So I'm going to pass the mic back over to Ian to close out our webinar, but I think we do have a little bit of time, if we have certain questions that people would like to bring up.
I have not seen anything come across in the Q&A. section. So if anybody wants to raise their hands, I can let them speak, but yeah, I think we're just going to wrap up today. Thank you, Monica. The pandemic's really given us a lot to think about, and I think your insights and resources are going to prove invaluable to all our attendees, and we really appreciate it. I want to thank everyone for attending today. You'll be receiving an email shortly with a link to all of the resources that Monica has discussed today, as well as a survey link. Your feedback is greatly appreciated. Our next ACG Pittsburgh event is an in-person Future Corporate Leaders Reception at the Hofbräu House next Thursday, October 15th from 5:30 to 7:30. This event will take place on their outdoor terrace, and we will be following all necessary COVID-19 regulations to be on theme with today's presentation. Registration is still open on our website, acg.org/Pittsburgh, and we hope you'll consider joining us. Enjoy the rest of your day, everybody.